Welcome back, everyone, to today's Reinhartz Rundown. We are pushing right along through our COPD review series. Now, if you're like me and you like to have a quick bite of clinical pearls and disease management reviews, go ahead and hit that subscribe button because we've got a lot of great content coming your way. Remember, there are 3 hallmark symptoms of COPD that are both chronic and progressive. Number 1 is dyspnea. This is the most common or cardinal symptom of COPD. Number 2 is cough, and number 3 is sputum production. For our prior video on dyspnea and shortness of breath, go ahead and check that out. We'll make sure there's a link in the notes below. But today we'll be focusing on chronic cough. This is often the first symptom that a patient might present or experience, and it might be sporadic or come intermittently at first, but eventually it really will be present every day and throughout the entire day. Remember also that there are a lot of other conditions which can cause a chronic cough. I'll make sure we pop up a list here on the screen for you, but they range from postnasal drip to gastroesophageal reflux or GERD, tuberculosis. Can't forget our medications like ACE inhibitors, and of course comorbidities like heart failure. Go ahead and pause the video here if you want to take another second to read over those. Also, the chronic cough in COPD can be productive or non-productive, and it can be cough and sputum production that presents in around 30% or so of our patients. Remember that chronic bronchitis is a manifestation of COPD, and we identify it through sputum production. It is characterized by a consistent sputum production for 3 or more months a year for at least 2 back-to-back years. Lastly, sputum production is really helpful to discuss with our patients at each visit, as a sudden increase in the amount of sputum produced is often a sign of inflammatory processes that are flaring. This gives us a clue that an acute bacterial infection and a possible hospitalization for COPD exacerbation is coming. That's the Reinhartz Rundown. Subscribe for our next video, and we'll dig into the practical and most clinically appropriate tools that you can implement in your practice to assess COPD symptoms and evaluate whether the efforts you're making with your patients really are translating into improved symptoms.